So since you mentioned the mechanical part, so why should we avoid the overuse of the word mechanical?
Yeah, a funny coincidence. Last week I heard from I got the quote from a friend. He heard from a clinician an answer on this, and the clinician said, because our patients are not cars. And I think there's a lot of truth in this funny and straightforward statement. So and to be honest, I think I haven't run a single mechanical evaluation in the last 15 years. And if somebody would call me a mechanical therapist, it would be almost insulting, because I think we don't do mechanical therapy. Our patients are not machines, are not cars, are not bikes or whatever. So we are always treating the person. And maybe it's also a cultural or language issue. In Germany, if you tell the patient we are doing a mechanical exam and then we do a mechanical treatment, that sounds a bit strange. So I know where we're coming from, and it was fantastic in the 50s, 60s, 70s, and 80s when Mac came up with the system. It was so important to set a counterpoint against surgery, against medication. So to show that movement and exercises can be so valuable. So, and he started this mechanical thinking, or talking about mechanical aspects, which was fantastic at the time. But I think we moved forward, and we should not limit ourselves to just be the mechanical therapist. I don't want to be a mechanical therapist, not at all.
That's very interesting, because I think, at least in the US, in Brazil, we use a lot this term related to McKenzie.
Might be a cultural or also a language issue.
Yeah.
It can be so, but I don't feel well using this term, and up to now we don't really know what is mechanical pain, and we don't have mechanical syndromes. We have the McKenzie syndromes, and we different diagnoses. I think we tend to overuse the mechanical in our system, which kind of we limit ourselves, we restrict ourselves to only this mechanical aspect.
So let me ask you then, how would you describe to your patients and to the public in general, what do you do? So how do you test? How do you use the system? Like, do you use other words to describe?
Yeah, I'll talk a lot about movement, activity, exercises. So, and nowadays people are well aware that they don't move enough, they don't exercise enough. Very often they have kind of awkward postures during the day, which we know might be responsible or not for some pain. We don't know exactly. There's a lot of discussion on this, but it's quite easy to get them on board if you talk about movement and metabolism, and just getting your muscles functioning and blood flow and all the stuff. So it's not mechanical. It is everything. So we know that when I talk with patients about loading strategies, I explain them how fast their musculoskeletal system might react, or their system in total. So and they all agree, the fastest change you have is up here. So if you feel better, if you start, for example, exercising, or you start a workout, you feel better. Immediately after you stopped, you feel better, or you have done something. So you feel better here up in your brain, or in your mood is better. And then cardiovascular is also reacting quite well. The muscles are reacting, the tendons a little bit slower, the joints slower, the bone very slow. So I explain them how the system reacts on exercises. But they are all well aware that the first thing which might react is their mood. They feel better. We should not only focus on what we think, what is happening with our exercises specifically, we should also think about the positive side effects this all has. So, and I think there was a nice podcast, or was it I don't know, was it an article? I read something about, I think it was from Greg Lehman from Canada, about the positive side effects of exercises. So even if we can't show that, for example, exercises for your knee are beneficial for your anterior knee pain, but the exercises, they might make you move more than usual. So you might burn calories, you might lose weight, you might go out and have some fresh air. So with all the positive side effects. And maybe it's the side effects of direction preference exercises which are so beneficial. I don't know, and I don't care. So